Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey, physical therapist and physician advocate, and she brings together a few guests, always gives me the opportunity to meet new people from across the physician wellness space. I have Sarah Hollander, psychiatrist, and Kelly Holder, clinical psychologist. Today's Kevin MD article is Joy in Medicine, a New Culture. Everybody, welcome to the show.
Thank you, Kevin.
All right. So,
Thank you.
Kim, obviously we have you on. So, first off, how did you find Sarah and Kelly?
So, Kelly, I was privileged to meet last year at the Dr. Lauren Bean Heroes Foundation Healthcare Worker Wellbeing Day in DC in March. And she was a presenter, and she was so positive and dynamic, and I loved her message. So, after the presentation, I approached her and thanked her and told her so. And we exchanged contact information. And then Sarah and I connected more recently on LinkedIn. And I thought that they would enjoy getting to know each other. So, I had them on my podcast together speaking to this topic, and it was such a great conversation. I wanted to continue it further, and I asked if they would like to collaborate again, and they enthusiastically responded. And that's how we brought this message to you today. And Sarah, when we collaborate, one person writes a little, another person writes a little, and I try to tie it all together. And Sarah had written first, and this sentence just got me in the gut. She says, "Yet every July, something remarkable still happens. A new wave of residents walk through the hospital doors, white coats still stiff, with hearts still open, and carrying hope."
Excellent. Today, we're going to talk about joy in medicine, a new culture. Kelly, you're a clinical psychologist. Just briefly tell us a little bit about yourself, then jump right into the article for those who didn't get a chance to read it and summarize it.
Sure. So I'm Kelly Holder. I'm a clinical psychologist, and I've spent the last 9-10 years of my career working in academic medicine, supporting the well-being of medical students, residents, faculty, and staff. I'm currently in a new role supporting healthcare providers in oncology and cancer care, and I've gotten to get back into my clinical work as a health psychologist, supporting the emotional well-being of the cancer patients where I work. This article was a privilege to write with this team, this idea of joy in medicine and exploring what that might mean. In the article, we talk about joy as being something that can be taught and transmitted. And that quote that Kim just explained, Sarah lovely wrote in this idea that in spite of all the challenges that we talk about that happen in medical education, folks still want to continue. They still enter residency with that bright hope and wanting to move forward. As we move forward into my portion of the article, we really talk about what does it mean to bring joy into the work that we do. This idea of joy not just being an emotion, but joy being a value and how it shows up when it intersects with the challenges that we face and then the ways that we support each other moving forward. And how could we think about that as an anchor point for us moving forward in the work that we do in healthcare and medical education?
And before I move on to Sarah, Kelly, just tell us, what does joy in medicine look like? Because I think that whenever we talk, especially on this podcast, we talk about things like physician burnout and really all the negative aspects that really obstruct medical students, residents, and physicians from giving the best care that they possibly could to patients. So what's your definition of joy in medicine in concrete terms?
Yeah, my definition of joy in medicine is that joy moves beyond happiness, thinking about joy in terms of a value that aids us in building community and holding on to hope in the face of obstacles. So when we think about joy in medicine, we can think about the hope and support we offer to patients as we're caring for them, but also the hope and courage that we present in dealing with the culture of medicine and the work that we do and how we do it together. So that's what I think about when I think about joy in medicine.
All right. So, Sarah, you are a psychiatrist. So, briefly tell us a little bit about yourself and then tell us what joy in medicine means specifically to you from your perspective.
Sure. Thank you so much for having me today. Yes, Dr. Sarah Hollander. I'm a holistic and existential psychiatrist. I did follow the traditional path of residency, medical school, but Throughout my life and through training, I always had much larger questions about meaning of life, purpose, a lot of existential questions that were always just a part of my own being. Joy was a big part of my upbringing. And particularly when Kelly and I met, I know she works particularly a lot in joy. And as a psychiatrist and a holistic psychiatrist at that, we look at the biopsychosocial model, that's an older model, but now we're really starting to move into the spiritual dimension. And what does that even mean? Much larger questions to ask: purpose, fulfillment. And sometimes it is going to be about religion or spirituality, depending on the patient. So why do I bring that up? Even in terms of not just patient, but even how we are as people and clinicians and what we bring to the table. Joy is also often a very nervous system oriented thing. In order to be and have joy, it means that your nervous system is in a certain place and it carries a certain vibe. You hold yourself in a specific way. That's something that you give off and other people can feel and relate to. They can feel safe in your presence if someone carries joy. And so when we created this article, a lot of that was about joy, not just as a value, but also what you transmit.
Sarah, in the article, you mentioned that the current medical system sometimes mistakes endurance for excellence. Talk more about that and how that can affect joy in our physicians or not.
Sure. So endurance, when you think about it, you think of grit, you think of tenacity. And while fantastic and needed for the longevity of a marathon of what medicine and the career in medicine is, when I think of endurance and I think about when it's not in balance, what happens in the body is it's more of a pushing
Mm-hmm.
sensation. It's a lot of resistance and pressure while constricting yourself. So it feels like a lot of shame. It feels like playing small. It doesn't feel like you can take up the space that you're allowed to take up. But when you have joy, when you feel that, that's much more about a pulling sensation, a calling, an expansion, a brightness. And when you work from that place, everybody around you feels that and gets joy from you. And so do your patients, and so do everyone else around you. And it's a beautiful thing.
So the next part, I want to ask both of you, of course, how can we implement techniques to gain some of this joy that both of you are talking about? But before I do that, Kim, as you hear Kelly and Sarah's perspectives about what joy in medicine is, tell me what you learned most from listening to them, working with them, and reading about their perspectives.
Well, one thing that's interesting is our article showed up immediately after an article you shared where the question was, is medical school culture replacing academic rigor? And we were actually going to write a follow-up article, and we'll have to see, we'll regroup after this. And this physician, and again, I'd love to have a conversation with him because I always come from a place of curiosity.
Mm-hmm.
And he puts like culture in quote marks several times throughout the article, and welcome, as if, is that really important? Like one of the sentences he says is, in the end, patients are concerned with how welcome a surgeon felt in medical school. They care whether the scalpel is ready. And I beg to differ. I've seen 42 doctors over the past few years, and I've had all kinds of experience, and I left a few doctors. And I feel like belonging is such a critical word and related, and that's the sense I get from them, the joy in medicine and how it's related to the word belonging. And what just struck me right before we came on is, I don't know if you know, but we have a new book coming out, White Coat's Human
Mm.
Hearts. And Dr. Simon Craig, who you know, writes his chapter is Finding My Place in Medicine, the journey from isolation to belonging in healthcare. And even the section headings are belonging as a practice, fostering a culture of belonging. Culture is the catalyst for change. So to me, those words, culture and belonging, really is so important in everything.
So, Kim, you were mentioning that previous article. How much do you think that's a generational difference? Because meeting Kelly and Sarah for the first time, they look relatively young to me. But how much of it is a generational perspective from those physicians who were always practicing our healthcare system saying, this is always the way we've done it. There is no room for joy in medicine. So, Kim, tell me what you think.
Right. So I haven't looked this physician up yet, but I would be interested to know how long he's been practicing. Now, of course, I'm almost 60, so I would say I'm old school. But in physical therapy, we had that culture of join, belonging, and all that. But I do believe in medical training, it was different. And to your point, I believe there is a lot of that. They're like, I put up with it, you should, or they mistakenly think that's what made them a good doctor, but it could be that they're a good doctor in spite of that.
Mhm.
And I think that's a critical distinction.
So, Kelly and Sarah, I'm going to ask each of you in terms of next steps, how can we implement more joy in medicine? It could be within the medical education context or even for those attending physicians who may be listening to us today. So, Kelly, why don't you go first? What are some practical ways that we could implement some of the framework that both you and Sarah are describing today?
Yeah, I think starting in medical education, undergraduate medical education, some of the simple ways that it could be implicated and practically is if those who are teaching our students are able to disseminate the joy that they do have. So being able to share what the work is about from an emotional standpoint, but also in little ways helping students understand the pieces that make it happen. So beyond the studying and the work and the hard work, which everyone kind of understands, but who did you need to ask for help from? Who supported you with the things that are happening at home? How are you caring for your body and mind? The necessity of doing that. What kinds of things do you shift so you make sure your care for your body supports the work that you do showing up? And really sharing that in very practical ways. Also, around some of the challenges that come up when I hear physicians talk about burnout and moral injury and some of the changes and strains within the healthcare system, aiding students in understanding what they do to navigate those things as they persist in healthcare and how they share and work at micro levels to make changes even within their small teams and groups that make the work sustainable in the faces of the things that are happening in healthcare that make things difficult. I've often heard from students, once they get onto clerkships or get more exposure to the healthcare system, like, I didn't hear about any of these
Mm.
things. These are none of the things that came up, right? And so being able to aid them in knowing that we can find joy here, even though there are things that need to be improved. And even though every day doesn't feel happy or joyous, we are working as a team communally to support each other moving forward. So I think those things could really help.
Okay, Sarah, so tell us from your perspective in terms of practical things that we can do to implement some of this joy that you are describing for both our medical students and physicians.
I think that joy is something from my perspective, I've always seen things from a preventive and developmental perspective. And that's why I particularly talked about implementing this and through the educational system very early on. What most people don't discuss is all of the identity changes
Mhm.
that actually happen during a career and the educational process during particularly formative years at that. A lot of them come in mid-20s, early 30s. These are formative years right around identity. They're starting to understand patterns in their behaviors or not, which medicine will often push them into recognizing. And this is part of that issue. So I think talking about it early on, openly, is the first place to begin. They talked about things like burnout does happen sometimes. What does that look like? What are the warning signs? What can you do about it? And then if you keep adding to that every year, more and more, implementing a little sprinkle here, a little sprinkle there, a lot of that goes a long way and it normalizes it. It doesn't mean that burnout is normal necessarily. It just normalizes the beat of being able to talk about it because it's an important discussion to have. It's sort of like teens and sex education. It's an important discussion to have. It's better to talk about it than not.
Now, Sarah, I'm going to ask Kelly this question too. Give us an example or share a story of maybe a little bit of a before and after of either a medical student or physician where before you may have talked about them, they may not have felt that joy in medicine, and maybe an after picture where they would better appreciate the joy in medicine. Sarah, what would be a story or case study of what that would look like?
I actually loved working with medical students as a resident, and I loved asking them questions about what field did they want to go into and why. And when we really went into it, a lot of the reason they picked a particular field was because of old patterns and old conditioning, believe it or not. And when we discussed that, they had thought about it and they said, I wonder if that might not be the direction for me when I really look into it. And what place is it coming from? So when you ask them from before, oh, I want to do this because of X, Y, and Z, it was often because they wanted to prove something. But when you really get to the heart of who they are and what lights them up and what brings them joy, they start to recognize, well, this is what I really wanted to go into this for. This is what this is really about. This is what lights me up. And their whole body changes. And being able to tell them, look at how you just talked about that. Look at how you just lit up. Do you want to talk about that for 10 hours a day, or do you want to talk about the other one? And just even having the multiple conversation with multiple medical students was so fulfilling and so rewarding. And then hearing back from them years later, I'm so glad I pivoted, so glad I changed. This was such a good fit for me. And when you remind them what they do this all for, because sometimes we miss that, sort of like a horse with blinders on, because you have to do the day in, the day out, the everyday. You get lost and you forget, what is this all for? It's not just a career, it's such a calling, and it's such sacred work.
And Kelly, tell us a case study or a story that you want to share with us.
Yeah, the story I can't shake from my mind is about a physician towards the end of their career. They were working in a subspecialty that's known to be particularly difficult and had a wonderful career doing it. However, sometime during their later part of their career, had something happen that was especially challenging. And it challenged their identity in the work, it challenged their ability to show up. And this was something that they concealed. They did not share this with others. And upon retirement, I had the privilege of having multiple conversations with this individual as they were making that transition and talking about how they wanted to share this information so others did not have to struggle in that same way silently. And although the word joy never came up in our discussion, thinking back on those conversations, it makes me think about how this person wanted to hold on to their joy of doing this work and continue to do this work, but didn't have the spaces to talk about the particular challenges that they were experiencing and trying to figure out ways to keep that from happening to others who might have those similar experiences. And so I can see how, because Sarah shared at the beginning of careers, as we move towards the end of our careers, in the middle of our careers, there is that need for that community that is very supportive in us holding on to the joy of doing the work that we do.
We're talking to Sarah Hollander, psychiatrist, Kelly Holder, clinical psychologist, and of course, Kim Downey, who brought us all together. She's a physician advocate. The Kevin MD article is Joy in Medicine, A New Culture. Now, I'm going to ask each of you just to end with take-home messages they want to leave with the Kevin MD audience. I'll start with Kelly and then Sarah, and then we'll always end with Kim. Kelly, why don't you start first?
Yeah, a take-home message is I really want those who listen to this to think about the ways they think about joy. We can easily throw it into the bucket of happiness. And as I've been doing research, joy has been understudied. We know that joy has elements of both a value, it can be motivating, and it definitely moves beyond emotion. So don't let this conversation about joy trip you up because you're not strong on the happiness part of your life. We're talking about something far beyond that, something that is integrative, something that holds people together, gives us hope, and anchors us in being able to live the lives we want to live. So consider how you think about joy and think about the ways it can be incorporated into your life beyond feeling happy.
Sarah, your take-home messages.
If any one of you is struggling out there, it's important to recognize that you have community and that you are not alone, first and foremost. And what you are going through is something that is okay and something that we can handle. But don't be afraid to speak out to someone that you trust, because there are ways to mitigate that and still move forward and still find joy again. So this is my reminder. Don't lose hope in yourself. Don't lose hope in our profession. We are here to make positive changes for you, for everyone, for our patients, and more to come.
And Kim, we'll end with you, your take-home messages.
Sure. I would say the more I'm involved in these spaces, individuals and teams and systems are all inextricably connected. So when we're talking about joy, it's not just individual joy, it's teams and systems. And Simon also in his chapter shares stories about chocolate cake and curry puffs that changed everything. So it was those moments, but it was with teams. And then that changed the culture of whole systems. It affected him at an individual level and team and system. And I'll just share a quote from Paul Westfield. He shared this on one of my posts yesterday. Communication skills combined with emotional intelligence are the foundations for leadership and team effectiveness. And he's a former fighter pilot who helps hospitals and physicians minimize error risk and improve patient safety. And they aren't just soft skills aren't optional. They're really foundational.
Everybody, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thanks
Thank you
for
so
having
much
me.
for having us.
Thank you for having me.